The results are in on the latest new technology in skin lifting and tightening. Today, we're going to be talking about one of my new favorite non-surgical treatment options for face lifting and skin tightening. Ellacor, the new revolutionary microcoring technology. I'm Dr. Stephanie Kappel, and I'm a board-certified dermatologist and double fellowship-trained cosmetic dermatologist, and I'm here to be a source of truth in a world that is flooded with misinformation and clickbait education. I provide these videos as a free educational resource for you guys to be able to truly age in reverse and to beautify your skin at every age. This video is part 2 in a 2-part lecture series for non-surgical facelift treatment options. Last week, we discussed the newest PDO thread lift technique that's giving incredible results. So if you missed that video last week, be sure to watch it. Today is the long-awaited follow-up video for Ellacor, the new microcoring skin tightening device. After having it over a year in my practice now, I'm going to share with you my real before and afters and my experience with this device and the results that we're getting on our own patients. So without further ado, let's take a deep dive into Ellacor. So what is Ellacor? Ellacor is a revolutionary skin tightening system that uses microcoring as the mechanism of action to help tighten the skin. So microcoring is just removing little microcores of skin out of areas where there's loose, lax skin to help tighten it up. It's different than other modalities that use like heat in the form of various different energies like radio frequency or microfocus ultrasound or other tightening mechanisms because it's basically just shrink wrapping the skin. So it's FDA approved for the lower face for the treatment of moderate to severe fine lines and rhytids, which rhytids in dermatology just mean wrinkles. So usually people have a lot of laxity or gathering or fine lines and wrinkles down here, especially when they put their head down or they look to the side and it gathers here. That's what microcoring or Ellacor is FDA approved to treat. Microcoring versus microneedling. What is the difference? Microcoring uses skin excision to help tighten the skin. Microneedling usually just uses the traumatization of microneedlings puncturing the skin to induce collagen synthesis to help tighten skin or to remodel scar formation or to improve the appearance of fine lines and wrinkles. If you guys follow me, you know I'm not the hugest microneedling fan, and the reason why is there's a very high complication rate with microneedling in my opinion, and patients are usually underwhelmed with the results. They usually require multiple treatments. It can be expensive, it can be painful, and the results aren't very impressive. So I'm not the hugest microneedling fan, but microcoring is totally different. So microcoring, skin excision, skin removal to tighten skin. Microneedling, basically just traumatization from microneedles puncturing the skin to induce collagen synthesis and scar remodeling. Now microcoring does not have any energy or heat involved with the treatment, whereas microneedling can be paired with either radiofrequency or heat to help stimulate collagen synthesis. Microcoring has little hollow needles that basically punch into the skin and remove little microcores out of the skin. Microneedling are not hollow needles. They're solid needles that just basically puncture the skin, do not take any skin out, but just induce a very controlled wound healing environment for the hopes that you'll have skin changes, improvement in texture, and so forth. Does Ellacor boost collagen? It may boost collagen, but that's not its main mechanism of action for skin tightening. The mechanism of action in the way microcoring or Ellacor tightens the skin is basically by skin excision. You're reducing the skin surface area by 10%. So if you're ever doing this where you're pinching your lower face and you're kind of gathering that skin up, all that skin gets removed, and that's how you tighten the skin. But it's not being removed in one linear incision like a facelift scar would present as. It's basically removing thousands and thousands of little microcores in a scarless fashion to help shrink wrap the skin. You're taking away loose excess skin to tighten the skin. There's not really any collagen synthesis or collagen stimulation. Now compare that to an energy-based device like Thermage, for example, where you're inducing collagen synthesis, and through that mechanism of action, that's how your skin's getting tightened. You can tighten skin multiple ways. You can remove it to kind of tighten it up and shrink wrap and remove that excess skin, pulling it together like a facelift would be or like Ellacor would be, or you can induce collagen synthesis, which is going to lift, tighten, and pull, which is what like energy-based devices like Thermage can induce skin tightening through that mechanism of action. So I wouldn't say that Ellacor stimulates collagen, but it does tighten skin by removing skin. Thermage stimulates collagen, and that's the way that it tightens the skin. So what areas can Ellacor be used on? It's FDA approved to treat the severe or moderate to severe rhytids and fine lines and wrinkles on the lower face laxity. Now we use it a lot off-label on other areas like the neck, the chest, the inside of the arms, where people a lot of times get a lot of collagen loss, and especially if they're estrogen depleted, will get scrapiness on that thin area of skin on their arms, the medial thighs, above the knees, in the abdomen, especially after having babies where there's a lot of collagen loss and skin laxity. Ellacor works great off-label in these areas. Again, it's not FDA approved, but just being on the circuit giving lectures at a lot of our academic meetings, a lot of doctors who are renowned specialists in the field of dermatology and aesthetic and laser dermatology, we talk about off-label uses, and we had discussed at several meetings that off-label use of Ellacor for skin tightening on these areas that are not the lower face perform really, really well. We've had really happy patients, really successful cases where we've treated non-lower face off-label areas with Ellacor with amazing results. Usually it takes anywhere from 1 to 3 treatments for the best results. The company always recommends 3 treatments, but it always is a case-by-case dependent treatment protocol. Some patients may respond well to just 1. Other people with a little bit more skin laxity or a lot of more loose skin will need more than 1 treatment for best results. But it is FDA approved for the lower face. So again, all these treatment areas are off-label. A lot of people will ask if we can do Ellacor on the forehead for like a brow lift or on like the under eye. Although we have other treatment modalities that work exquisitely well at tightening that skin, especially for non-surgical brow lift and under eye firming, smoothing, and tightening, Ellacor is not a good off-label use for treatment of these areas. So I wouldn't use Ellacor on the forehead to lift the brow. I wouldn't use it for tightening the periorbital skin or the under eye area, but I would use it off-label for like neck, chest, inner arm, abdomen, and thighs, and above the knees, where people always get crepey skin and always struggle with that area. It's a great non-surgical treatment for those off-label areas. Ellacor for lip lift. This is one of the best indications for Ellacor. So lip lift surgery is when a surgeon will take the extra skin between the nose and the upper lip and shorten the length between the nose and the upper lip. And this gives a more youthful, more cosmetically pleasing appearance. And the only treatment for lip lift today is surgery, with the exception of Ellacor microcoring skin excision, where we basically do Ellacor above the upper lip to shorten the distance between the nose and the upper lip, which gives a more youthful appearance and can make the upper lip look fuller and more rejuvenated. So it's a perfect option for people who have increased length between their nose and their upper lip, and this gets accentuated as we get older, and that length gets lengthened as we get older, or for people who don't want lip filler but want fuller looking lips, because by removing that skin, it just kind of averts the upper lip without filler, which gives a really beautiful full upper lip. So I've been really busy in my practice with Ellacor just for lip lift indications with Ellacor, and we've had great results. Now, the only other option for lip lift to date is surgery, and surgery will often leave a scar underneath the nose where the suture line goes. And even with the most astute plastic surgeon and the best surgical technique, that scar can still be there. I've actually had a lip lift surgery years ago, and I still have a scar there, and I've lasered and I've done multiple lasers on my scar to help it, look less noticeable, but it's still there. And it's just a great option that's non-surgical for having that same lip lift result. Now, in 2 weeks from now, I'm going to be posting a lip lift video, so be sure to subscribe and hit the notification icon so that you're notified when that video comes out. But to date, like I said, the only 2 options for lip lift are surgery and Ellacor now as a non-surgical option, which is really, really nice. So this can be done on people of all ages, even though that length between the nose and the upper lip lengthens as we get older. Sometimes younger patients are just anatomically born with a longer philtrum or a longer piece of skin between the nose and the upper lip, and by doing Ellacor, even in my younger patients, they can avoid surgery while having those same results. And of course, the more treatments you do, the more skin is removed and the shorter that distance gets, because if Ellacor is removing about 10% of the skin each treatment, if you do it 3 times, you're removing about 30% of that skin, which will really help increase those results and kind of give a fuller, more beautiful, youthful, and natural looking upper lip. So Ellacor versus Thermage, how are they different? Thermage uses heat in the form of radio frequency to stimulate collagen to help lift, tighten, and pull the skin taut and help with lower face rejuvenation especially, and neck. Ellacor differs from Thermage because it is removing skin in little microcores of skin excision and will help tighten the skin, but through that different mechanism of action. Ellacor versus Thermage, Ellacor is not inducing a profound collagen synthesis pathway in the skin versus Thermage and energy-based devices that do that. So for my younger beauties who are trying to be more proactive in increasing their collagen stores, for a collagen banking or collagen boosting treatment, I would recommend Thermage over Ellacor. Now for my more mature beauties who aren't looking for collagen stimulation, but just basically maybe don't want to have a facelift but have loose skin that they want to excise and remove to tighten the skin, that would be more of an Ellacor candidate. So typically my younger patients who want to be proactive with anti-aging, collagen bank, if you're not familiar with that term, you can refer to my other videos where I talk about collagen banking. Even myself, I did collagen banking procedures when I was 30, 35, 40, and 45, and now that I'm 46, I'm seeing the benefits of these preventative treatments that I did earlier on, and that includes more collagen banking procedures that are going to induce your collagen stores. So as we lose 10% of our collagen each decade, you're basically having reserves that are going to keep you looking the same for the decades to come, despite the rapid aging process, especially that happens after age 40, which I'm experiencing now. So unlike Thermage or energy-based devices, Ellacor is not going to stimulate collagen, increase your collagen stores, collagen bank, and be a more preventative approach. It's more of a reactive and reversal approach for people who have loose, lax skin that need a little tightening and they don't want that awful facelift scar. Now, Ellacor is not going to give you facelift results. It's not going to give you a facelift result, but the benefit is that it's a scarless fashion. You're not going to have that facelift scar, and of course you don't have to undergo surgery, which can come with a whole array of complications that you don't have to worry with minimally invasive procedures. Ellacor is FDA approved for treatment of skin types 1, 2, and 3. So any skin types that are Fitzpatrick 3 or higher, I'm always very hesitant to treat because of the risk of hyperpigmentation. There are ways around that. There are ways that you can stabilize the melanocytes with active ingredients that can help pre and post condition the skin to minimize that risk, but it's definitely not a 100% risk averse treatment, because hyperpigmentation, especially with Ellacor, is always a risk, even in lighter skin tones. I think between Ellacor and Thermage, if hyperpigmentation is a concern, I would much rather go with Thermage than Ellacor. In prejuvenation treatments, I would go with Thermage. Darker skin tones, I prefer Thermage over Ellacor. And then also, Ellacor usually requires more than one treatment. So it's anywhere from 2 to 3 treatments spaced a couple months apart depending on the patient. When it's been over a year, the company recommends at least 3 treatments for best results. Ellacor versus PDO Threads, how are they different? Ellacor as a skin tightening device that removes skin is different than PDO Threads, which can be used as a biostimulatory string-like filler that also mechanically lifts up on the skin. So PDO Threads are a type of suture material that lifts up on the lower face. We could use it for brow lift, we could use it for neck lift. If you missed my last week's video, we went into a deep dive into PDO Threads and their multiple uses. So the mechanical lifting of PDO Threads plus the biostimulatory component of the PDO Threads work in that mechanism to help lift, tighten, and pull, especially of the lower face, versus just removing skin. So it's a different mechanism of action, but also the length of results may vary and differ between the 2 treatments. PDO Threads typically last about a year or so, and the biggest downside of PDO Threads is I wish that they lasted longer. So Ellacor Results typically last about 5 years or so, but that could vary depending on the patient's age and the rate that they are aging. For example, someone who is in their 6th or 7th decade of life may have Ellacor Results that last about 5 years, but they're also rapidly losing collagen and aging at that time. So there's some compounding factors that make it difficult to say the duration of results with respect to Ellacor treatment, which can vary with a patient's age, the quality of their skin, and other treatments that he or she has had before the treatment and after treatment also. So those are just things to take into consideration as well. Okay guys, so I'm gonna actually show you Ellacor really quick, what it looks like. So this is the Ellacor device. It has a little handheld applicator, and you put the cartridge in for the Ellacor machine and you put in your settings. There's different settings that you can do. There's a cartridge that goes on the end of this, and there's a touch screen where you can pick out what settings that you want. So you can increase the potency or how much skin is removed per treatment for each treatment session. So it's actually like a little tiny, cute, handy device. You should have seen in clinical trials how big this thing was. It was not as sleek and smooth as it is now. But this is Ellacor. That's what it looks like. Just a little guy who can do so much. Okay guys, I'm just switches in between patients. Stephanie, my amazing laser nurse specialist, who is the only one who I trust with my lasers, just did Fraxel on my backs of my hands, my neck, and my chest. So I'm just getting the results now. She did it about a week ago. We've been working together for 12 years now, and she went back to nursing school, so I had to wait for her to come back to me. But she's honestly been treating me for the last 12 years with lasers and just has the perfect settings, the perfect everything, and I'm just so stoked on my results. Okay, I need to move on. Ellacor versus facelift. So this could be a controversial topic, but I feel that saying that a non-surgical treatment will equal a surgical treatment is just false promising. And so the benefit with Ellacor is that you're not undergoing general anesthesia, you're not in an OR, you're not having the risks and complications that come with a major surgical procedure, but the results may not be as substantial as a deep planing facelift, and you wouldn't expect them to be. Ellacor is removing skin. So when you do this and you kind of pull up your skin, all that removed skin that is coming out through thousands of thousands, 8,000 to 9,000 microcores of skin will equal the same amount that would have come out with a facelift minus that horrific scar. However, it's just skin deep. Deep plane facelifts, with or without fat transfer, with bone grafting, with moving around muscles and tendons and ligaments and the SMAS, you're doing a lot more than just tightening the skin. So deep plane facelift or more invasive facelift is going to have a more substantial result than Ellacor, which is a non-surgical skin tightening device. So the two are very different. However, for someone who's not ready for surgery or not ready to embark on the risks associated with surgery or undergo general anesthesia, or they're not ready for that horrific facelift scar, then Ellacor may be a better option, and it will not preclude you from having surgery down the line. They've done extensive research studies to demonstrate this, and you always have to be careful because now with everybody on YouTube and on social media and people marketing their procedures, plastic surgeons a lot of the times want you to have a $150,000 facelift instead of a $5,000 Ellacor procedure. So they're going to promote OR procedures and surgery, of course, over non-surgical or minimally invasive procedures. And I could speak as a non-invasive cosmetic dermatologist, but I can also speak as a dermatologic surgeon who has spent many hundreds of hours doing flaps and grafts and grafting on skin cancer patients who have had these cosmetic procedures. And I can say that it shouldn't decrease your candidacy for having surgery later on. And I think it's important for plastic surgeons to know that plastic surgery may not be an option for many people for health reasons, for concern for risks of the procedures. Maybe there's a spouse or family member that isn't understanding or supportive of a woman having surgery, so she has to go through non-surgical treatments to address the same issues. So I think it's really important for physicians, including myself. Now, I'm a woman, I do a lot of these procedures myself, so I can speak as a patient and as a provider that it's not a one-all, be-all answer like yes, surgery is better or yes, Ellacor is better. It just depends on your situation, on the degree of improvement that you want to see, aversion of any risks that could be associated with a bigger procedure. A facelift and a surgical procedure is not going to be the same result as an Ellacor procedure. Now, if you have 2 or 3 Ellacor treatments, then you're going to get more of a result than if you just have one. But will it ever be the same as a surgical result from a facelift? That would be false to say. The answer would be yes, because Ellacor is just excising and removing skin, and it's just skin deep. It's not doing anything to the fascial planes or the SMAS or the ligaments being tied up or fat transfer or a lot of the other components of a facelift that's involved in that procedure. But the upside of Ellacor is that you don't have to undergo general anesthesia. You don't have to worry about the risks and complications, nerve damage, all of the horrific scars, things that are associated with surgery, and it won't preclude you from having surgery in the future should you decide to go down that path. And can it buy you time? Yes. Is it a lot easier to go through? Yes. And it's about a week of downtime, and we'll get into the downtime and the risks of Ellacor in a minute. Ellacor versus facelift, it just depends on a patient by patient basis what you're looking for, the degree of laxity, the degree of improvement that you want to have done, and also balancing out that with the risk of scarring, complications, nerve damage, general anesthesia, all the things that come into play. So surgical versus non-surgical both have their pros and cons. Surgical is usually more impressive with results, and non-surgical is a little bit more safer and risk averse for people who want to be cautious and may not be ready for a surgical procedure. Who is a good candidate for Ellacor and who is not? The ideal candidate for Ellacor is someone who has moderate to severe laxity, especially on the lower face when they look down or when they're putting their head down, with that skin that's gathering right here, estrogen depleted, collagen depleted, and thin skin with lots of little tiny rhytids or wrinkles. Who is not the ideal Ellacor candidate is someone who just wants a little prejuvenation, collagen banking, snatching of the jawline with minimal downtime, only one treatment needed, a very low pain tolerance. That would be more of a Thermage candidate. So it all just depends. I always tell my patients you have to be severe enough to be a good candidate for Ellacor. Otherwise, Thermage is probably a better treatment option. Other candidates for Ellacor would be people who have scar tissue, who have already gone through laser resurfacing, because usually ablative and non-ablative lasers, especially Fraxel CO2, is the mainstay of therapy for scar remodeling for people with acne scars. But Ellacor is a great option for these patients also. Sometimes people with a little lower face laxity, if they want to tuck that area up a little bit, Ellacor is a really great device to help tighten that up. Neck laxity for people who may not want to do a laser, or they've already done different combinations of laser treatments on their neck and they want to try a different modality. If you do just one, you're going to get improvement. But if you kind of dabble in and do a little bit, a medley of all of them, you get the next level results that you want. So I always feel like people who have a little extra skin under the chin, if there's a little bit of neck laxity, but if they've done a different combination of treatments and they want to look into something new, I think Ellacor would be a great option. Someone who's not an Ellacor candidate, someone who is darker than a Fitzpatrick skin type 3. Again, my area of expertise is treating darker skin tones and skin of color with lasers and devices, and knowing which ones to use and which ones to avoid, and how to manage post-inflammatory hyperpigmentation or hypopigmentation is really part of my area of expertise. And I wouldn't say Ellacor is FDA approved for skin types darker than a Fitzpatrick type 3, but there's always exceptions and there are ways to kind of manage around it. But I always feel like if you're prone to hyperpigmentation, Ellacor may not be the ideal treatment for you, and there's other treatments that are safe and effective for darker skin tones without the risk of hypopigmentation or hypo, or dyspigmentation of the skin. So what to expect after an Ellacor treatment? And I think the biggest downside of Ellacor is the downtime. It is brutal and it looks horrific, but the results are amazing and you look worse than you actually feel. So when you look in the mirror, you're gonna have these little red or brown hyperpigmented demarcated squares, like almost like a grid-like pattern where the device was, but it rapidly heals. And there may be a select few patients who have prolonged what's called post-treatment erythema. And it happened to one of my best friends she was my first Ellacor patient post-clinical trials who I treated, and I didn't have her stop any of her supplements or blood thinners, so she bled a lot during the procedure, which was fine, but may have contributed to that post-inflammatory erythema lasting longer. We also didn't do V-beam, which is a laser that we now do 1 week after Ellacor to help decrease the appearance of the red demarcation where the device is. But that's something that is really important to remember for the week after treatment. We just have you use just plain Vaseline morning and night, no skincare actives. I think my friend was also using skincare actives that she probably shouldn't have been using during that treatment duration after. But usually we have patients just wash with a gentle cleanser, Vaseline morning and night, and then just avoid any skincare actives. And that's the hardest part for people, to just be away from their actives. And then also when that prolonged erythema lasts, if it lasts longer than 1 week after the treatment, then we'll usually do something called a V-beam. Sometimes you'll need a couple rounds of that. Some people don't have any redness at all. Some people have redness that lasts about a week. Some people have it that lasts a little bit longer and will require several other subsequent treatments with laser. But it's nothing that can't be reversed. And usually patients are very, very happy in knowing going into the procedure that could be a risk. The risk of downtime in the post-treatment erythema is, something that will be discussed, and if that is a deterrent for certain people, managing expectations is really important. Also, post-inflammatory hyperpigmentation can be an issue as well. Now, knock on wood, I haven't seen that with any of my patients, nor did I see it in the clinical trials, even with our Fitzpatrick skin type 3 patients. But in theory, whenever there's traumatization to the skin, post-inflammatory hyperpigmentation can always be an issue, even on fair skin individuals too. So what we can do sometimes is give the patients some melanocyte stabilizing actives like hydroquinone or any non-hydroquinone skin brighteners, kojic acid, vitamin C, to kind of help fade the hyperpigmentation should it occur. But I haven't seen this as much as I've seen the erythema, which is usually responsive to the V-beam laser. The last thing that I wanted to say is that although the downtime with Ellacor can be brutal to look in the mirror, it may be hard to look in the mirror, but you don't feel bad. You're not in any pain, or you shouldn't be in any discomfort after Ellacor. Now, maybe because of the injections for the anesthesia, you may be a little sore, you may be bruised, bruised, you may be swollen from the anesthesia, the local anesthetic that we use. You shouldn't be in too much discomfort or pain. So it looks worse than it feels. Okay, on that note, I need to go pick up my kids from surfing. They went surfing after school, and it is time to get them off to their other activities. And I just finished a full day in clinic, so I'm gonna finish the rest of this video at home with y'all, with me in my house. Will Botox and filler be affected by Ellacor? And the answer is no. Although you wouldn't want to get Botox the same day as you have an Ellacor treatment, because the swelling from the Ellacor can make the Botox migrate outside of the injected site area. If you already have neuromodulator that's active, like you've had Botox in the past and you have the results that are still present, Ellacor won't diminish that. Also filler, the company says that you shouldn't have filler 6 months prior to Ellacor. I haven't really seen a problem with that with my patients, and I feel like that was more for the FDA trials so that Ellacor could be demonstrated to show results without any augmentation from any other procedure. I think during the clinical trials we wanted to see that Ellacor is giving actual results and it wasn't from, you know, filler being injected or other treatments. So I think that it's safe to do Ellacor and filler at the same time. Now the caveat would be if it's a very superficially injected filler, the filler kind of get squished out of the skin in the area that you're getting Ellacor if it's very superficially placed. But usually that shouldn't be an issue. But like an area like a tear trough or something that's very superficially injected like skin weave, it might be an issue. How long does it take to see results from Ellacor? It typically takes about 2 to 3 months to really see the results, and it continues to improve to up to course of 6 to even 12 months after treatment. Usually patients start to notice results within 1 month, but it's always safe to say it takes 3 months to really see the results from Ellacor, and know that they will continue to improve and it will continue to show more and more results as time goes on for up to 12 months after treatment. And usually if people are going to get more than one Ellacor treatment, the company says do it 1 month apart, but I always say wait a little bit longer because you'll start to see the manifestations of the results from your previous Ellacor treatments before having a second or third treatment. How long do Ellacor results last? And the answer to that question can vary depending on a patient's age. Again, if there's collagen depletion, if it's estrogen depleted skin in a postmenopausal patient, sometimes the results may not manifest as long as they should because you're also aging at a faster rate. But for all intents and purposes, the results of Ellacor should last about 5 years. Now, if you're in your 30s or your 40s, then those results will definitely last for 5 years. But if you're postmenopausal in your 60s or above the age of 55, you know, the results may be also compounded with a rapidly advanced aging process that's happening at a faster rate than someone who is younger. Also, you know, a lot of people, I'm in Orange County, Newport Beach, California, a lot of my patients, not from me, but from other providers, are on Ozempic or they're having dramatic weight loss. So even if someone is younger and may not be aging at a faster rate, if they're dropping a bunch of weight and losing a bunch of volume in their face, their Ellacor results will still be lasting 5 years, but they're also having other changes in their skin that is kind of like offsetting those results. So it's always important to just remember everybody's different, everybody's skin type's different, everybody's collagen stores are different, and hormone profiles are different among patients. So the answer is it lasts 5 years, but it's always important to consider confounding factors which could be altering the manifestation and duration of the results from Ellacor. So now that we're back home, I'm going to finish some of the questions that I often get asked. Can I still have a facelift someday if I've had Ellacor? And the answer is absolutely yes. There's a lot of fear-mongering going on with plastic surgeons saying that certain non-surgical treatments will preclude you from having a surgery later on, and that's simply not true, especially with Ellacor. Now that may be true for certain procedures, some more than others, and it's also very patient-dependent and can vary on a patient-by-patient basis, but because Ellacor is literally skin deep and just removing excess skin, it should not preclude you from having a face or neck lift later on. Now many plastic surgeons use Ellacor in their offices, and they wouldn't have this device in their office if they didn't recommend it pre or post procedure. So what to expect at an Ellacor treatment? And I'd have to say, after using this device for over a year, and if you count my clinical trials when I used this back in 2017 and 18 and a little bit of 19, the most uncomfortable part of the procedure is the numbing. Now we typically use nerve blocks, which are either injections that are through the mouth or transcutaneous to help globally numb certain areas of the face. And even when we use topical numbing cream before administering the local anesthetic or nerve blocks, it can be a little uncomfortable. Now some patients say they don't feel it at all. Some patients will say that, you know, it's 4 or 5, maybe 6 out of 10 on the pain scale when we're applying the anesthetic. There are certain things we can do to the numbing to make it not sting or hurt so bad, but for most people, it's very, very comfortable. Now, it all just depends on everyone's pain threshold and level of discomfort. But I will say that usually patients are pretty comfortable, and usually I don't have to use nerve blocks. We usually use a topical numbing cream. Patients come in an hour prior to the procedure. The topical numbing cream is applied, and then we use different doses of local anesthetic, and that has to be dose dependent on your weight because there are lidocaine toxicity doses that we have to be mindful of and avoid. So it's very strategic with how we administer the numbing. And what I've been limited to as a provider is that patients will come in and they're like, I want Ellacor from here to here to here, get my neck, can you add in my arms, do my abdomen, do it everywhere. And the thing is that you're limited with how big of a surface area you can safely and effectively apply the local anesthetic. So that's usually, as a provider, what limits me, is that you have to confine it to a smaller area because of the amount of lidocaine or injectable numbing that we use. So I would say that's probably the most uncomfortable part of the procedure. The procedure can be a little bit loud. Most people have YouTubed the procedure and like they've seen before and afters, and they've seen encounter videos of what to expect. So it's usually not that scary. And I would say the after experience after the procedure, you're swollen and you may have some bruising from the anesthetic and the injections of numbing, and you may feel full and puffy and swollen, but you're going to have those bruises and those demarcated squares that can be disfiguring, but they usually go away. And if they do stick around for a longer period of time, it happened with my first patient, which happens to be one of my best friends, but we didn't intervene, we didn't do a laser, we kind of just let it run its course because we wanted to see what, you know, it would look like if we didn't treat the post-treatment erythema or the post-inflammatory hyperpigmentation. In those cases, usually it can last for over a month or even longer in some individuals. Now, personally, as a provider, most of my patients have done pretty well. Usually we proactively will use the V-beam treatment to kind of diminish the appearance of the erythema, and if they're a darker skin tone or someone who can hyperpigment from any traumatization of the skin, like if they burn themselves on a stove and they have a hyperpigmented scar, or if they have, you know, a bug bite and they itch it and they hyperpigment, or acne that they pick out and they hyperpigment, then we'll give those patients a hydroquinone or non-hydroquinone skin brightener to prophylax, to suppress those melanocytes, which are the pigment producing cells, to make sure that they don't hyperpigment. And I would say for all intents and purposes, people do really, really well. I have not yet seen any demarcation on the skin after Ellacor that is more a textural or a topography irregularity, but it's usually more a color variance that is usually treated with laser or post skincare or even a combination of different lasers. So I would say the thing to know into going to Ellacor is that the numbing is probably the most not fun part of the procedure, and the aftermath, you do have those demarcated areas where the Ellacor treatment was done, but you shouldn't be bleeding, you shouldn't be uncomfortable, you shouldn't be in any pain, and if you have any bruising at all, it's usually where the Ellacor device was, but it's also the injection sites for the anesthetic. And that's something that you can hopefully decrease the incidence of by staying off of anything that thins your blood for 2 weeks before the procedure. Of course, if you're undergoing medication or any blood thinning medication by a provider for another reason, you want to consult with your providing physician. Like if you're on aspirin or some type of blood thinner for some cardiovascular reason, you won't want to stop that medication without consulting with your providing doctor first. But if you're on supplements like vitamin E, fish oil, flaxseed oil, if you eat a lot of salmon like I do, you're going to probably want to cut back on that before your appointment to minimize bruising. But usually people do really well, and we'll just have them apply a thin layer of Vaseline. We try to avoid Aquaphor because it has lanolin in it, and that could be pro-reactive in the skin. Very thin layer of Vaseline, morning and night, gentle cleanser. We don't even tell you to use sunscreen. We just tell you to kind of avoid the sun for about a week after the treatment, and that's pretty much what you need to know. Now, a lot of people will say, well, Dr. Cabell, why can't I use my actives? But what happens is if you use actives, like for example, elastin nectar, you can get little silicone granulomas because you have openings in the skin. Once the microcoring device takes out columns of skin, it's like an open channel for like big molecules to get into the skin. And if your epidermis closes on top of that, then you've made like a little cyst in your skin, essentially, that can give problems and give rise to something called granulomas or nodules later on. So we just say avoid, because there's been reports of it. I've never had it in any of my patients, knock on wood, because when I started using the device in my office, you know, I'd attended meetings and had talked to colleagues in the company, and they always recommend just a thin layer of Vaseline. But for patients who were using some of those actives, they were having some issues, and I think it's because particles, some of those active ingredient particles, are getting into the skin and getting into those microcores made by the device and was causing problems. So I always say, Vaseline morning and night just for a week. After a week, we come and see you in the office, do a V-beam, do another laser if we need to for hyperpigmentation or a melanin stabilizing actives, and then we'll have you continue your normal skincare regimen, which everybody's usually very stoked to start, and they're looking good and they're starting to see the results of the Ellacor and they're happy. So after having this device for over a year in my office, what are things that I've learned? There are many variables that can make the treatment better or worse, and it can be very provider dependent. Getting out the actual microcores is a big deal, because if you're just microcoring the skin and these hollow needles are little punching little holes, like almost like a cookie cutter into the skin, and they're not suctioning out the skin because there is a vacuum component to the device, and you're cookie cutting the skin with microcores, and there's a vacuum component that will suck the tissue out, and you'll have these little open holes that close in. It's like taking a block of cheese, solid cheese, and making it into Swiss cheese and then closing the holes. You're shrink wrapping the skin. But if those pieces of skin don't come out, if the suction on the device isn't optimal, if the tube is too long, if the provider is holding the handpiece incorrectly and it's choking off the vacuum and it's not pulling the skin in through the vacuum to be dispensed and removed out of the skin, then the results won't be as good. Also, the assistant assisting the surgeon or provider doing the treatment is very, very important. It has to hold the skin very taut. The pair has to work very well together, the assistant and the provider, and it's like a tag team action. There's a twisting motion that they'll usually perform when doing the Ellacor procedure to twist and to remove those little skin pieces out of the skin. Getting the right angle and vantage point of having good contact with the device on the skin to get those microcores out is really, really important. So positioning, the pressure that you put on the skin, holding the device a certain way to get better results is really, really important. So make sure that you're going to a provider who's very well versed with this device, ask how long they've trained, how long they've been doing it, ask to see the before and afters to get the best results, because it is very operator dependent. Like every treatment procedure that we always talk about on this channel, it's very operator dependent, but that is why. Position, pressure, holding it correctly, the angle, the positioning of the patient in response to the provider, the assistant holding the skin taut. So there's a lot that goes into play, and sometimes I'll have the company just visit my office, make sure we're doing everything right. Sometimes we've switched out the cartridges for one side of the face versus the other. We've played with the different settings, and you can adjust the settings for Ellacor to remove like 8% of the skin, 5% of the skin. There's different percentages, and we've come just from experience knowing certain skin types do better with certain settings than others, and that just comes with experience. So it's always important to go to a provider who's very comfortable and experienced with this device to get the best results. So my take on Ellacor. So I used this device many years ago when it was still going through clinical trials, and when devices, whether it's a laser or energy-based device or a microcoring device, which is new technology, goes through FDA approval, it takes many, many years. So I think people don't realize that things that are like new haven't been new to us as dermatologists who are involved in clinical trials and using these devices for years and years and years. And as they go through that process, depending on side effects, complications, things that happen in clinical trials, they make modifications. Sometimes the device that gets FDA approved isn't the same device that it was when it first was engineered, 6, 7, or plus 8 years ago. So the device, when I did the Ellacor first video, I told you guys, hey, I want to just test this out. I want to use this device in my office before and treat real patients before I come out with a follow-up video, which you guys have all been asking me for, because the device that I knew and used may be different than what actually got FDA approved. So I do think that, the differences between results we got in the clinical trials and what I'm actually getting in the office, they're great results. I wouldn't compare the two as being 100% identical. Now, I don't know, if there were any changes that were made, but I think that the device in today's world, as it's available to the general public, I feel like there may be needing more than one treatment for the results. And that's not for everyone, but I don't think it's like a one and done treatment that we kind of thought it was before. And so I feel like if you're deciding on having Ellacor as a treatment, just know in your head that you may need multiple treatments to get your endpoint goal that you're looking for. So it's all about patient expectations and management of patients. Now, I have one patient that actually didn't really respond at all, didn't really get the results that we were looking for. He had really great skin to begin with, so it's hard to tell when you're going from someone with not that many imperfections or fine lines or wrinkles or rhytids to getting an end result, sometimes it doesn't make as noticeable of a difference if you're starting out looking amazing and then your end result is a little bit of an improvement, but it's not a huge jump in improvement. I feel that the best patients for Ellacor are people who don't want to have surgery and or want surgery maybe in the future, but not at this point, and really have a lot of laxity. Because if you're going from like a 9 to a 10, it's not going to be a huge difference in someone who maybe hasn't really taken care of their skin, has neglected their skin, and they need a bigger jump and improvement. It's almost like you need more severe wrinkles for the results to be a little bit more impressive. But that's not to say I've had great patients who have done really, really well who didn't have that much. They more had like heaviness on their nasolabial folds, and the Ellacor helped lift that up, or a little heaviness on the marionette lines, and that helped lift it up. But I feel that it's almost better for thin skin, lots of rhytids right here, and the more severe the laxity is, the better you'll notice the improvement with Ellacor. And then always keep in mind that it may be multiple treatments to get your endpoint goal. Now, I've never, knock on wood, I haven't really had an issue with post-treatment erythema, pigmentation, those red squares. Yeah, you look like that for a week, but the downtime isn't the issue with this device. It's just managing expectations and knowing that it may not be a facelift result, but it can actually do great things. And I've had a lot of happy patients receive great results with Ellacor, not only on lower face rejuvenation, lifting up on the nasolabial folds, but also like abdominal skin, patients who had crepey abdominal skin and didn't want to have like an abdominal surgery scar or like an abdominoplasty or tummy tuck scar, did beautifully and well, just really great results. Also, your other areas like the neck, skin laxity there, patients have done really, really well there too. So whoever you go to for a provider for Ellacor, if you're even thinking about it for consultation, just know that you need to have your expectations managed appropriately. Now, many people say, I've had one treatment, I like it, now I want a little bit more and a little bit more. And then when they go from, their baseline to their post-3 treatment results, it's more noticeable. If you're thinking about Ellacor, look at your other options, including surgery or other forms of non-surgical treatments like Thermage. I'm not a huge soft wave fan. L-therapy, I'm not a huge fan of either because I feel that those results are a little underwhelming. But look at all the options, not just what I say either. Like, go to other doctors and consultations. You can't always trust YouTubers because unlike myself and some of the other YouTubers out there who are actually clinicians and seeing patients in the office, a lot of YouTubers aren't using these devices and are not treating patients. And they also may be in contract with another company and they're more just marketing and making these videos to sponsor different companies. But I feel like clinicians who use all these devices and can recommend one for you is the best one to go to and get a third, second, fourth opinion and see if Ellacor may be right for you. But I have nothing but positive things to say about it. I have had a handful of patients that were underwhelmed with results, and I was underwhelmed with one patient out of the hundreds that I've treated that didn't really have that noticeable of a difference. Now, he didn't really have any complications and he wasn't worse off, but he also was starting with pretty amazing skin to begin with. So anyway, that's my take on it. Hopefully you find this useful. It's just honest and true, unsponsored, unbiased, science-based education and videos for you guys. So that wraps up our 2-part series on non-surgical face lifting and tightening. I hope you guys learned something. Drop a comment in your comment section. Remember, I'm most responsive to comments within 24 hours of posting my videos every Sunday morning. And that's because Monday through Friday, sometimes I'm in the office just seeing and treating patients, Monday through Thursday, depending on my Friday, but I'm in the office seeing treatments and actually seeing patients as a clinician. So I'm not on my YouTube channel, but I am responsive the first day that this video posts so that I can get back to your comments in a timely manner. And then once Monday hits, I'm all eyes on my patients and my beauties in the office doing these actual procedures that I'm talking about on YouTube. So I hope you guys enjoyed this. Let me know what else you want to hear about and stay tuned for next week's video where we're going to be talking about hyperpigmentation, melasma, brown spots, darker skin tones, how to adjust for lasers and treatments to safely treat melasma and sunspots and brown spots and hyperpigmentation and darker skin tones as well. So I hope you guys look forward to that video and we'll see you next week.